Joy Stay is a registered nurse and international board certified lactation consultant. She will tell you, however, her greatest achievement and highest education of learning has come from being a mother to 5 beautiful children and a wife to her best friend. Professionally, she has worked in different environments and capacities, from hospitals to third world countries, to clinics, birth centers, and home births, in the capacity as a care provider, educator, and advocate, forming friendships and relationships that have built bonds and life-changing lessons that have helped her grow and continue to better serve the people in her circle of influence. She is greatly passionate about equipping and educating women and men about their holistic health and its effects on future generations. She currently does this by advocating for breastfeeding and a healthy lifestyle, encouraging and teaching that breastfeeding doesn't have to be overly complicated. It doesn't even have to be stressful. Her desire is to meet families where they are, to find peace and joy in the journey. She finds strength and passion and purpose, spending her days loving and growing in her relationship with Jesus, her husband, and her children. Help me in welcoming Joy Stay to the NFP Podcast.
Welcome to the NFP Podcast, where we explore the empowering world of natural family planning. I'm Amy Smith. Join me and my co-host Emily Appledorn each week. Together, we're here to dive deep into the science, the stories, and the spirituality behind NFP. Every week, we push back against the free love culture and advocate for a culture of responsible love, where intentionality and respect are at the forefront of family planning. Join us as we discuss everything from the practicalities of charting and fertility awareness to the profound impact NFP can have on relationships and communities. Whether you're new to NFP or a seasoned pro, our podcast is your go-to resource for honest conversations, expert insights, and real-life experiences. So grab a friend, settle in, and get ready to be inspired. This is the NFP Podcast. Welcome to the podcast, everybody.
Hi there.
I'm super excited. Today we have on with us a friend of mine and the nurse from my first birth. So I'm super excited. Her name is Joy Stay. Welcome to the podcast, Joy.
Thank you for having me.
So Joy is the woman I think of to go to whenever I have questions about nursing. I know I reached out to you too, Joy, after I had the twins, I think, and I had a pretty traumatic experience with the pediatrician and nursing. And so she's just, even though it's been years and we don't talk regularly, I just feel like she's always someone I can go to get a reasonable, unbiased thought, and it's never like being told what to do, which I always appreciate. So she's here to share her wealth of knowledge with us as a international board certified lactation consultant and registered nurse. So Joy, I'm hoping we can frame our conversation. Emily, as always, just jump in when you have questions and things pop up too.
Sure.
But I'd like to start out, I guess maybe let's start out with a little bit about you. So tell us how you got interested in nursing and in becoming a lactation consultant, all of that.
That's a hefty story. I'll try to condense it. Obviously my passion for God and his people, very much so. From the time I was young, I've always wanted to help and advocate for people. So as soon as I graduated high school, I lived overseas. I lived in Honduras. My parents were missionaries over there. And so I did a lot of medical translating for people, for doctors and nurses who came. And so I felt like, that's what I want to do. I want to go back and get my medical degree and see where it goes from there. So I came to Arkansas. I'm not originally from Arkansas, and got my nursing degree and worked in there. Didn't know exactly what field I wanted to really hone in on. I would do anything because I love it all. I enjoy education and learning, and God put me towards, I worked as a pediatric nurse for several years in the hospital. And then after that, I went to the birth center. And through all of that, like I said, I could go down so many rabbit trails, but I realized there was so much that people didn't know about taking ownership of their health. They just listened to the medical field. and though it has its benefits, and I'm thankful for the medical field, learning how to navigate that. I wanted to empower people on how do you navigate the truth with the lies. And so, and just empower people to make educated and informed decisions. Because I saw that a lot, working in the pediatric world, working in neonatal, and then even going into the birth center, just how the politics kind of get mumbled jumbled in there. And so that's when I decided to become an internationally board certified lactation consultant, because I went down the rabbit hole and I was like, okay, where does it start? Like, where's the key point where I can help empower parents, where I can help people to take ownership of their health? And so I went down the lactation route. And even still to this day, I'm like, oh, there's even more. I can go further. And women's health. And I love like natural family planning. To me, that's more than just how do I not get pregnant? There's so much more to it. And it's about empowering people. It's about empowering them. So I don't know if that answers the question of it. It's been my last 16, 17 years of my life. In between, they're having kids.
It makes me think of you were trying to get to the root cause.
Yeah.
What it sounds like. How far back can I take this as far as where can I meet people at the most impactful time that will transform perhaps the way they live their life and they raise their kids? That's beautiful.
Yeah. That's just how it started. And now I don't even know which direction I'm going other than
Well, you're 2 months after having your fifth baby. So right now you're healing and getting into the swing of the new baby life.
Yes.
So,
yes.
yeah. One thing at a time.
Yep.
So over your years, I guess, of working with women, especially during, I want to talk about nursing specifically in the postpartum time, because, our podcast, we focus mainly on, natural family planning. And I don't know about Emily, but that postpartum time, I think for a lot of women is just a whirlwind, especially the first time parent, right? A whirlwind. There's just a lot going on, and let's hone in on the woman, right? There's this nursing thing that we have to do, or that we want to do, right? We know, we're told and we know is just best for baby and best for us. And, such a good thing we want to do. And there can be a lot of obstacles in the way. And one aspect of the nursing journey that we come across as NFP teachers is the impact it has on fertility. Mm-hmm. And most women, and I think this, Emily, I'm curious what you would say, but I think this is totally normal, appropriate, just fine, is after you have a baby, you don't want to get pregnant again right away, which again, you just had a baby. Like, that's okay. I've heard some women feel like almost guilty about that. I'm like, why? Totally normal. Totally normal. Your body is not thinking, let's do that again. So, physically or mentally. Right. So, okay. So that's kind of the mindset. But then, at the hospital, protocol is let's get them on birth control before they walk out the door. Mm-hmm. So let's, I guess, start there, Joy. Do you know of what's your knowledge, I guess, about the impact of birth control, if there is anything, we're talking hormonal type of birth control, on a woman's ability to nurse? Is there anything with that connection there, or no?
Very much so. It can go all the way back to before preconception, the effects that birth control or hormonal birth control have on women's body. You're messing with their endocrine system. And the problem as a lactation consultant that I'm starting to see is we're putting young girls who are starting puberty, putting them straight on because it's not regular, or whatever the reason is, or, not teaching our girls about how it happens and just putting them on the birth control. And so it's affecting their breast development. It's affecting their hormones. So when you go off that birth control, and then you try to get pregnant, you have infertility. There's a lot of research coming out about secondary infertility based off of birth control. And that does affect then how your body responds when you go to breastfeed. Your breasts aren't considered mature until after you have actually lactated. So
wow.
Yeah. So the different stages of the development and maturing of your breast tissue, the hormones, the milk ducts, everything does not, you are not considered a mature breasted woman until you have lactated. So the problem with hormonal birth control is it's impeding your body to go through those phases. So then you go off birth control, you get pregnant, and your body's still trying to catch up with breast development. And so you have low milk supply, you have insufficient milk duct development. So, I mean, it's a very, so like when we talk about hormonal birth control, you're talking about, it's not just,
well, the brain and the impact on ovulation. I mean, Joy,
right.
I had no idea there was even an impact on your breast maturation. That's so fascinating.
So it goes deep, and it then affects, it affects, like you said, the brain. So that the endocrine system is what causes you to lactate. So if your endocrine system doesn't know how to make oxytocin, prolactin, because estrogen, a lot of times what's in your hormonal birth controls are estrogen and progesterone, right? A combination of that in a
synthetic versions of that, not even actual bioidentical versions of that.
Right, exactly. And so that's suppressing your body from being able to make those hormones naturally. So then when you take them off of it, well, oxytocin and prolactin are the two that cause you to lactate. And they are based off of what your levels are for estrogen and progesterone. So it's a huge cascade of effects that hormonal birth control can have. And women aren't being told that. And that's where I get really passionate. They're not being told, hey, if you go on birth control now and you want to breastfeed, this could impede your ability in 10, 5 years, however many years, to have a successful breastfeeding relationship.
Do you think they're not being told because it's being kept from them, the information? Or do you think women aren't being told because doctors and physicians don't know?
I think doctors and physicians, the majority, I would say, they just don't know. That's been my experience when I bring it up to different physicians or nurses. They're like, oh, no, that can't be possible. So I just, but the research is coming out. If you dig far enough and follow certain trails, then you'll find it.
So interesting. Wow. Okay. So, so there's yet another reason to not put our teen girls on hormonal birth control when they're having cycle issues, but instead to try to get to root causes and address those. So,
so many reasons.
I know. It's just so interesting. So you're saying
when you can't learn anything more, and I'm being completely facetious, but
no.
There's something else that I just had no idea.
Right.
Yep.
So based on what you just said, Joy, then is it right to say like a 40-year-old woman who's never had a baby, never lactated, like her breasts are technically considered immature?
Yeah. From my training, that she would not be considered to have mature breast tissue because she has never lactated.
Wow.
Now that is a small caveat, which is another bunny trail, is we can still lactate even if you've never given birth.
Oh, right.
Okay. So there is that, like, we can go put her into that state.
Okay.
But it's a little bit more involved than just
having the baby, and that's kind of the easier direct route. So
yes.
Okay, gotcha. Yeah. All right. So we, have baby, we decide not to use birth control. We want to nurse, we want to avoid a pregnancy. So some women have heard about the lactational amenorrhea method. Now I know Emily, we both worked with women in the postpartum period, teaching them NFP. And I think one of the big things I kind of learned as my years of teaching progressed was, one, my understanding, and then two, my understanding of what the other person was understanding. I say something, you say something, do we really understand what you're saying? So I say, tell me, are you exclusively breastfeeding? And then client says, yes, I am. And then I say, okay. And we move on. And as time went on, I realized, you know what? I need to know what you think that means. So when we say someone is exclusively breastfeeding postpartum, what does it look like for you to be nursing and suppressing ovulation? What does the nursing behavior have to look like? What is that relationship as far as frequency, intensity, where baby is, are we using pacifiers? Are we supplementing with, water, bottle, etc.? Because I think some women think like, well, I am nursing. It's like, well, I'm nursing like every 3 hours. They get a little bit of formula. They use a pacifier. Like, is that going to have the same impact on suppressing ovulation as someone who's co-sleeping, using nipple as pacifier? Like, I mean, that perpetual suckling, like, and maybe just starting from the first, like, what is physiologically, how does nursing suppress ovulation? What is the connection there?
Yeah. First, I want to say, you were talking about the miscommunication. I always say we're using the same words with a different dictionary.
Right. Yes. Yes. Right. Yes.
Because I get the same thing with lactation, like obviously on a different, but like when you ask them questions and then you're like, oh, that doesn't mean the same for you. Like,
yes.
And
yes.
sometimes I've learned it depends on cultural, and what they've been told and like where they're coming from, their worldview.
For sure.
Figuring out what that is. But so lactation, amenorrhea. In the beginning, so it's just lactation without a period. So with any bleeding within the first 56 to 60 days, you're considered, that's all postpartum bleeding. Your body's healing, your uterus is healing and all of that. But for exclusive, like the definition that I would give exclusively, like you said, is breastfeeding every 2 to 3 hours. And there is no supplemental, like no formula, no pacifier, nothing other than just mom and the breast. Mm-hmm. And obviously that's hard for moms in our culture and in our society. And again, another is that caveat is, what does it look like to exclusively breastfeed in our culture and in our society, in the societal pressures that they put on us, and the unspoken rules that moms receive, unsolicited advice, all of those things. And I've learned that is a big, well, I heard on social media that I can give them this or I can do this. And so it's very much so laying down to create, again, it goes back to that hormonal response. If you have a baby suckling at your breast, you have an oxytocin release, which then has your body make more milk, and then it causes prolactin, right? Prolactin is what's going to suppress your estrogens and your progesterones, and that's what you need to ovulate. But if you're not having those hormonal spikes, then your body's going to go back into that ovulation cycle.
And by hormonal spikes, you mean the prolactin spikes?
Correct. Yeah. The yep.
Prolactin. Okay. So let's also frame this then too, just to kind of get everyone in that mindset of so postpartum, we've just had the baby, and our body, remember, is during our reproductive years, it's only thinking one thing: prepare for pregnancy. So it's constantly trying to get back into that cycle of, follicle forms, mm-hmm. follicle releases egg travels through fallopian tube, egg, if fertilized, implants into the womb, have a baby, or if not, egg drops into the uterus, there's no baby, then, we shut our lining and we have a period, and we keep doing that. So after we have a baby, right, like body is like, okay, heal so we can get back to doing that. Right. And so it's trying to do that. So you are, after you have a baby, you are pre-ovulatory. Mm-hmm. You are perpetually pre-ovulatory until you have your first true period, which means you ovulated about 2 weeks before that.
Right.
So, so that's where we are, I guess, in that season. The body is trying to do that. Now with nursing, like you said, Joy, every time we nurse, oxytocin, prolactin then goes up, and that's telling the body, oh no, we're not going to ovulate yet. But it's almost like the ovaries and the brain are kind of fighting back and saying, okay, as soon as prolactin goes down, okay, let's try to ovulate again. Right. And then we say, no, we're not. Prolactin, go back up, like we're nursing. So it's kind of like this body's going back and forth, like, well, we're trying to get back in this cycle, but you're nursing and you're saying no. I mean, it's kind of genius when you think about like almost the design of our body, right? That God would say like, no, like you are in high demand right now. Hence the prolactin signaling to the body, like you cannot afford, quote unquote, to ovulate right now. You don't have the capacity to ovulate right now, which is very smart of God. Yeah. So then, so did I have that correct, Joy?
Yep. Nope.
Okay.
Beautiful.
So let's talk about, women will get very frustrated with this conversation and they'll say, well, I got, my period comes back 1 month after I have a baby or 2 months after I have a baby. And I say it in that tone because that's often the tone I'm hearing women say it to me in, very frustrated and angry. And so I guess now my initial response to that is not anger and not accusatory, but just curious. And I'm like, well, I'm curious, like physiologically, why is that happening for you? And when you say I go back to the question of like, you say you were exclusively breastfeeding. What did that actually look like? So yeah, what do you say there, Joy?
As a lactation consultant, we'll kind of go from that. I would sit down and I would say, okay, let's walk through your day. Let's walk through your night. Because my goal as a lactation consultant is to meet them where they're at, knowing all those, like I was saying, like all the different things they're combating, and saying, okay, let's figure out make sure one, we're on the same page, and maybe where we can tweak a few things, because the last thing I want is for a mom to be overwhelmed and frustrated. I desire for moms to feel the passion and the enjoyment in those postpartum days, as hazy as it can be. There's a lot of beauty. I mean, like you said, God created it to be a wonderful bonding experience. It's just so beautiful. But with breastfeeding and all those hormone shifts and just everything that's going on, we can lose sight of that. So I'm going to meet them where they're at. And so you're going to want, and then I would explain like, okay, to suppress your period and ovulation, 2 to 3 hours. So let's see how we can fit that into your day. Maybe to have other kids that they're, trying to juggle, like, so they're missing that 2 to 3 hours. Maybe grandma's coming in and instead of the baby calling for mom's breast to feed, grandma's giving them a pacifier. Okay, let's see if grandma can give little brother Cheerios and you can take baby. Like those types of interventions. So I'm gonna walk them through that and just try to support them and helping them understand, if you want to suppress your period and your ovulation, you really cannot afford to go more than 4 hours once in a 24-hour period, because as soon as you do that, you're going to ovulate, like that's just what the research is showing. But if you follow all those 2 to 3 hours, 4 hours, you mentioned co-sleeping, it helps you get more sleep, do it in a safe environment, do your research, so that in your environment, it helps a lot. But I've heard women too, I got my period back 1 month, right? That's not all. And they could be doing everything right. They could be following the protocol. It kind of goes back to that initial question of birth control. If I have a mom who tells me my period came back, because it does affect our milk supply. When our period and ovulation comes back, it affects our milk supply for the reasons you stated. Our body's ready to have another baby. And so the birth control, I will ask them, did you deal with infertility prior to getting pregnant? Did you have any other health concerns, women health concerns, PCOS, endometriosis, all these other things, because those also run off of estrogen and progesterone. A lot of those are estrogen and progesterone heavy. So if you have endometriosis, we're going to see your period come back, and it kind of overrides that prolactin response. So like, wow. I deal personally with endometriosis. And so I do all the guidelines to suppress my ovulation. But I think the longest I've gotten is like 3 or 4 months.
Oh, wow.
Yeah.
And because of the endo, that's what's
yeah. So endometriosis is considered estrogen dominant. Now, with that said, when you breastfeed, it does help the symptoms of endometriosis. So like I've always breastfed my babies until we're mutually done, which is usually around 2. And so, but PCOS can be progesterone dominant. There's 4 different types of PCOS. And depending on the PCOS that a mom tells me she dealt with, I can then help her navigate breastfeeding accordingly. So some of those moms that you might be dealing with, they might have an underlying hormonal imbalance or autoimmune disorder. There could be a thyroid disorder
Mm-hmm.
that causes their menstruation to come back, even if they're following all those guidelines of breastfeeding every 2 to 3 hours, no supplements whatsoever. And I've even found moms who pump. So again, going back to work, that's a big thing for moms and women today. Even pumping does not give the same stimulation. It does not cause the same prolactin spike as baby at the breast.
Mm-hmm.
So if you're already sensitive, if you're already estrogen dominant or have progesterone issues, your body, you really need the baby at the breast to do that, which is always fascinating to me. Like,
yeah. And to your point, depending on what your home culture is like, what your lifestyle is, that's going to really dictate your availability to nurse and to, kind of be the one that is, whose body is comforting the baby when they need that comforting, as opposed to maybe another person or a pacifier or formula. Go ahead, Emily.
Is there any research, we all know these women, I can speak for myself, that don't follow those, the protocol, for example, and they still have a delayed return in menstruation significantly. And so is there any research out there to show why that could be?
Yeah. Are we all just like sensitive differently to prolactin levels?
Is every woman different? And I believe that's the answer is yes. But in the sense of when it really comes down to it with this postpartum time, is it really going to just kind of depend on the woman and her body's response?
Yeah, I've had the same experience. I feel like it just really is. Every woman's different environmentally. There's so many peels to the onion, like there's so many things you could peel back and say, well, it could be environmental issues. It could be work related. It could be family stress. It could be some women are more sensitive to just the minor changes and they have nothing wrong. And like you said, they follow everything. And then there's women who probably have endometriosis or PCOS, sleep train their babies to sleep at 8 weeks and their period doesn't come back till they fully wean, right? Like I've seen it all.
Yes.
Right.
Yes.
Right. Yep.
Do you find that after multiple pregnancies, a woman could say somewhat that she has an idea what her body is going to do? Or I know every postpartum time is different, but generally speaking, there are some similarities when it comes, I think, to
Within one woman.
Yeah, within
right.
one.
Yeah, that would make sense. Yeah.
Yeah. So I can speak for myself in that, like, obviously natural family planning has helped me a lot to just know my body and empowering myself. And I always tell women, like, empower yourself, understand your body. From the time I was little, my mom had this thing. She told us our body speaks to us. God created our bodies to communicate to us because we're whole people, like we're spirit, body, mind, and soul. And so I always have taken that with me and okay, my body speaks to me. My body is God through my body is telling me who am I? I'm made in his image. So what does that look like with the sin and the fall of man, right? Like not to get overly spiritual, but just like that whole like holistic approach. And so with each of my babies, all of my pregnancies have been fairly similar. But my births have all been drastically different. So I would expect my body to maybe have a different postpartum experience. But even with my 5th kid, and technically she was my 6th pregnancy, we had a miscarriage in between there. So like each postpartum period, I would say I can tell you now, like, oh, this is this is the cycle. Like this is what my body's going to do for the most part, with healing from each birth. So even with the different pregnancies and deliveries I've had, each one has been indifferent. And I don't have very many people who have had 5 or 6 babies. So usually the number tops out at 2, 3 at max. So I don't know how many women I haven't actually asked, like you said, to see if, hey, can you predict like what your body's going to do? I could ask my moms who are multips of like 7 and 8 and see, but I'm pretty sure they're going to say the same thing I did, that it pretty much follows a very similar postpartum
Like
I would
pattern.
say, yeah. And I would say in my anecdotal research with different couples, I would say that have had, let's say more than 3 kids, for example. I think they would say the same.
Yeah.
So it's so interesting how even with different pregnancy experience, different birth experiences, that the postpartum phase can still be a kind of a consistent healing experience.
Mhm.
Yeah.
Yeah.
I have a
Okay.
question.
Go ahead, Emily.
I don't know if there's any research on this, but as you're talking about the different things that affect milk supply and that nursing postpartum time, and just thinking about that even pre-pregnancy, it made me think about during pregnancy. Is there any research out there to show that women that supplement with progesterone during pregnancy have better milk supply? Or does that affect milk supply? Do we know?
Yeah. Supplementing for progesterone doesn't typically affect your milk supply one way or the other. When a mom tells me she has had to take progesterone at the beginning of her pregnancy, again, I'm going to ask her, no, do you have any underlying autoimmune disorders, or have you been diagnosed with anything? Because we have to ask the question, why did she have to go on progesterone? Sometimes it's because they have that, what we call infertility secondary to birth control for 5-10 years, right? It could be her age. Unfortunately, that is a thing. I was very much so reminded this last pregnancy that I'm advanced maternal age. And I actually had to go on progesterone this last pregnancy. And that was my, 6th pregnancy. And that's the only one I've ever had to go on. But research wise, there's not a whole lot that says that will. I mean, if you look it up, there's not.
I just wondered, just when you were talking about, hormonal birth control prior to even conception, it's just so fascinating to think that there's perhaps so many different things that could affect that postpartum time.
Yeah, it can. Again, it just goes back to that root cause, like what caused you to go on progesterone? Why did you have to? For me, I wasn't surprised, obviously, for multiple reasons. I've been a student of my body for, quite a few years now. And so, but a lot of times with my moms that I assist with, I'll ask them, and going back to, I'll ask them during pregnancy, like, did you feel any breast development? Because a lot of times that's why our breasts are sore. So that'll give me to what I'm dealing with as a holistic person. If they had, I'm trained as an international board certified lactation consultant. We're trained in how to tell if a breast tissue is mature or not. I can look at breast and be like, okay, that one's going to have a hard time producing milk based off of the shape, based off of color, based off of just development. You can look at that and see,
That brings me to another question I had was, can you speak to size of breast versus milk supply, and if there's any connection? I think we all probably know different stories of women that have very little breast tissue and are able to, very easily nurse their babies with milk supply. And then I know many situations where you would look at the woman and think she will not have any problem based on her size of breast. And that is not the case.
Yeah. Breast size does not dictate how much milk you're going to make. It doesn't even dictate how much milk you'll store. I always tell mamas, like I have some mamas who, they're like, I feed my baby every 2 hours. And they're having, I pump and I only get 2 ounces, no matter if I pump 2 hours or 3 hours or 4 hours. And I just say, hey, you're a 2 ounce mama, and that's fine. That just means you got to put your baby to the breast more frequently. You're just not going to be a 3 or 4 hour mama because you don't. And there's nothing wrong with that. There is nothing wrong with that. You are normal. That is beautiful. Like there's nothing. Don't listen to those lies that are saying, oh, if you can't take your baby 3 hours, because that's what's being pushed in the pediatric, going back to how to suppress your ovulation, right? You go to the doctor's office and they're like, well, are they drinking? Are they able to go to 3 to 4 hours? Well, if you're a 2 ounce mama,
no,
or you want to suppress your ovulation, you can't afford to go based off of those pediatric guidelines that they're pushing in the doctor's office. And somehow they relate that to development, and baby's health. And that's not the case at all.
So the pediatrician wants the baby to be able to go long stretches.
Right. They somehow deem that. I'm still trying to figure that out without being too passionate, um, of what they're trying to get at when they're like 3 to 4 hours. And it probably most likely has to be based off of, your formula recommendations. If you have a baby who's on formula, it takes longer for them to digest it. So therefore, naturally, they're going to be able to go 3 to 4 hours. Where a breastfed baby, depending on the content, the fat percentage that mama made, which we make different for fat percentages throughout the day. Each day can vary, each feeding can vary as to how high our fat content is. So sometimes a baby is only putting the demand on mom for every 2 hours and they get the perfect, but yeah, that is a frequent pressure I've been noticing on my clients, is that the pediatrician is expecting them, and somehow they feel like they're not making enough if their baby can't go 3 or 4 hours. And so then they start to push for that 3 to 4 hours, which then back to suppressing your menstruation. If you're trying to appease the pediatrician so that your baby can get their check marks at the office, you're taking that risk of allowing ovulation to start back up.
That was something that I learned when I had the twins, and I went to the pediatrician and was getting some push before I felt comfortable to supplement with formula, and feeling like my baby, just leaving in tears, which I feel like I'm very strong, and like I felt very confident. Like I feel very confident telling doctors no, thank you. Like I've been doing it for a long time now, but man, there's just something about, when you got your little baby there and they're saying that baby is not going to be healthy unless you do X, Y, Z. And it's just, it's like taking advantage of someone and fearing them when they're in such a vulnerable state, and a mom with their little one, like it's hard. So, but anyway, I remember being there and leaving those appointments sad, and contacting you and contacting another friend of mine who's, a family medicine doctor who's very a big proponent of the lactational amenorrhea method and just about nursing postpartum. And anyway, I learned that the CDC growth chart that my twins were being measured by included formula-fed babies. And formula-fed babies and nursing babies grow very differently. And twins grow very differently. I mean, granted, my twins, I had a very healthy pregnancy, birth, they were nursed right away. I mean, everything was just so great. But that those are different. It's not an apples to apples comparison. So maybe you can speak to that mom a little bit, Joy, who's, hearing from pediatrician, baby's not growing well. Like, how can we actually tell? And my mom was a lactation consultant too, a long time ago, but I still rely on her for information sometimes. I'm like, she was always so calm to say, like, is baby sleeping? Is baby eating? Like, what does baby look like? Like using these other forms of measurement, and how are you doing, mom? Like, to measure if everyone is healthy and doing well, and not some standardized chart at the pediatrician office. So yeah, maybe you can talk to that a little bit, Joy.
Yeah. So like you said, look at the baby. I always say treat the patient, not the chart, or not the machine. I actually learned that from a cardiac professor in nursing school. She was an old school nurse, and she always told us, she drilled it in our heads. Before you start, a code because of the machine, look at your patient. So it was just something. So I take that into this, like, look at your patient, look at your child. Are they growing? Are they happy? Are they having good sleep intervals and awake intervals? Failure to thrive is thrown out there a lot.
Yes. And it's scary. It's
very loosely, and it scares parents. But if you research what true failure to thrive is, it's very misused. So like, you have to see, no weight gain, no length, like they're not even growing, lengthwise, their head circumference. All of those things need to be taken into consideration before you just throw out failure to thrive. And I feel like doctors, I don't want to demonize doctors, because there are some really good ones out there. Right. And the ones that throw it out there, I don't think I choose to not believe that they're just trying to be malicious.
Right.
But as soon as they throw out, oh, we're going to watch and monitor your child for failure to thrive, that ticks a red flag off in a mom, right? And she's like, oh my goodness, my child is failure to thrive. They didn't
Yes.
hear the part where we're monitoring to make
Yes.
sure that they don't become failure to thrive.
Yes.
It hits the mom so deeply. And
It
I think,
does.
how could that not affect milk supply?
It does.
You're over
It
here.
does.
You're putting more stress on the mom. Oh, it's so
Yeah.
heartbreaking.
Yeah. So I would talk to a mom and sit down first, Amy Lynn, that I'm a big proponent of education. So I would point them in directions to try to give them the best, well-rounded to make an informed decision, an educated decision. Because at the end of the day, I never want a mom to feel like she was forced into a decision or look back on that period and think, oh, I wish I would have known.
Right.
I wish somebody would have told me. I wish I would have been more, whatever that is, after she comes out of that postpartum haze. But failure to thrive is thrown out there so rampantly,
Right.
that I just try to educate the mom. And it's so hard to give just a straight answer because I try to personalize my care to each individual person. And just meet them where they're at. I really do. And I try to sit there, hear their heart and say, okay, you know what I'm hearing, this is what I'm hearing from you. This is what I feel like you're going through. Sometimes it's not even like you were saying, Emily, the stress decreasing milk supply. I might need to sit there instead of being a lactation consultant. I might just need to be a friend or an ear for them to just decompress.
Right.
And instead of just giving them information, just say, hey, talk to me. What's going on?
Right.
Oh, and you learn a lot about somebody's life when you just sit there and listen.
Right.
That's right.
Right.
Listen
And I
about
think that's where, I think where I've settled now in our approach to healthcare is just knowing, I feel like just knowing what I'm going to get when I go to a certain source, like if I go to the typical family medicine doctor, this is likely that what they're going to tell me. And I feel like I have yet to be wrong, really. If I go to functional medicine person, this is likely what I'm going to hear. Because I know their training is actually different. To your point, Joy, they're not malicious, right? They're not evil. It's just, what are they trained and what's the information? And Emily and I know that from, teaching NFP. If you are a user of NFP, there is a high likelihood that you know a lot more about your body than your doctor does, which is kind of sad. We hope that's not going to be the case forever, right? Maybe things will change. But as of now, some of the training varies and the information available. So just even that one thing, learning with the twins, oh my gosh, that CDC chart that was haunting me, that has the population. And I should know this, right? From my research background, your sample population matters when you're forming information. And so knowing who are my kids being compared to, what is the standard of health that is set? Right. And do I even want that standard of health? That's a valid question, someone else is setting this standard of health. Is that appeal to me as something of health? Do I want that?
Right. Yeah. It's the chart is, I always tell parents, remember, if your child's in the 2 percentile, and this is kind of my way of, instead of going down the whole political trail of it's with formula and all of that, I say, okay, your baby was born, let's say at the 50 percentile, just keep them even, right? You grew a great baby, no matter whether they're in the hundreds, 98, 50, 2%, your baby came out healthy and they're fine. What I look at that chart is I'm just looking at the different, what's going on. Okay, that is not a diagnostic tool. It is not meant to be used for that. So I'm looking at saying, okay, we're just trending and that's fine. There's nothing wrong with your baby being it's 2 percentile, right? People are oh, my baby's in the 2 percentile. Something must be wrong. No, they're just 2% of that population. Right?
Right.
And we had to have the 2 percenters in order to have the 98ers, right?
Yes.
And helping them decipher the growth chart is one thing I spend a lot of time on, is helping parents be at peace with. It's not like when you're in school, you get an A+ or you're the star student because it's not the same.
Right.
It's a different.
And what's the size of the parents? You can look at a couple. I was just having this conversation with a a mom at the co-op last week, and the mom had been told by the doctor that the baby probably needed to be supplemented. And she was talking about the parent size and everything. You know, like the
Yep.
mom is small, the baby looked healthy, smiling, cooing, you know, all this stuff. But it's like, oh no, you should probably be supplementing. And it once again, treat the patient, not the chart, right?
Right.
Like, look at the baby. What do they look like? Like you're saying, like I think it gets hazy and cloudy for the mom in that postpartum time because your whole focus is on that baby, right? You're not even thinking about yourself. You know, you should be eating and sleeping and all these things, but your whole goal is on that baby. So if someone that you trust is telling you something, it's really hard to go against that in those times. And so hopefully, like Amy's talking about, we have a support system of other people too that we trust, that we can confirm or, you know, just get all the information that we possibly can of people that we trust, whether, hopefully we do trust our doctors, but hopefully we have other women and family members and friends that have gone through similar situations that can give us suggestions,
Yeah. I always say, don't take grandma out of the house too quick. You need grandma.
That's a great one.
Like we need grandmas, we need aunties, we need friends who will support us. I did want to say when you were talking, Emily, I was thinking, I never for women who are trying to use this podcast as a way to get informed. If you have a low milk supply and you've been recommended to pump to build your milk supply, that is not the same as exclusively. So you should still be putting baby to breast, which is going to cause that prolactin. So when I say like no pumping, no supplementing, all of that, that's not including, there's certain regimens that I will put moms on where it's like you feed the baby and then you're going to pump. Well, you're still putting baby to the breast. You're pumping to produce that supply and demand on your body. And then you're usually giving that milk to the baby. So that can still be part of the inducing that LAM, the lactation amenorrhea method, to help moms too.
I'm glad you brought that up, because would you say there's a certain time frame after baby's born that protocol can be really beneficial when it comes to long-term milk supply?
Yes, especially if I have a mom who has a history of a low milk supply. So obviously that first time mom, we're just trying to help her figure out her body, and like figure out what's wrong. And I don't want to put too many interventions because they're already stressed out. So I use that with first time moms, it's a too much delicate more than just throwing it. But if I have a mom has a history of, I was only able to breastfeed for like 3 months, or I was only able to, they're coming to me because it's their second, third baby. And they're like, I actually want to give this a try. It wasn't successful before. Then there's a very, usually there's a very, I walk very closely with them and we will implement that protocol accordingly.
That's great. Can you speak to supplementation, like over-the-counter supplements, herbs that do have, are research-based?
To help with milk supply, you mean, Emily?
Okay. That help with milk supply. So,
if there are any that have evidence to it. I know that we all hear different things. You should take.
Yes.
I don't really feel like there's a common idea of how much the dosing for different supplements. So you hear to take certain things, but nobody really says how much or how frequent. So I just wondered if there's any, research behind any of that.
Yeah. There's not a lot of research. If you Google most supplements or most of the like, hey, do this, you're going to get popped up. Oh, not enough evidence or not enough research, right? Like to support this. I'm currently doing an anecdotal study with some of my clients right now, because again, with the economy and everything, I'm all about how do I help moms without putting that extra pressure. If you're taking supplements that cost as much as formula, what's the benefit? What's the motivation apart from all the other benefits of breastfeeding, which could be a whole other podcast about that. So what's the benefit of that? And so currently I'm doing my own, I'll let you know how it goes. But there's so many supplements, like there's Blessed Thistle, there's, fennel. But again, depending on your medical history, some of those can actually have adverse effects on you. So we have moms who are going to Facebook or these social media platforms. They'll come to me and show me their whole array. Well, this low supply social media platform said I can, and I've heard some really crazy things that people have said, was increase their milk supply. So one size doesn't fit all. Sorry, Emily. Like it just,
No,
how
I think that's important to mention that the way you did, because I think that's where people go, right? Let's say the woman doesn't have a great support system. So naturally you go to these groups, right? And my understanding is exactly what you were saying, that some supplements can help women, but depending on underlying issues, you may be doing a little bit more harm than good. And I don't personally know how you figure that out. I mean, that would be a deep dive, I think, to know your body well enough to know, okay, I shouldn't take this supplement or that. But, I think about, eating and sleeping. And yes, we need some, a prenatal, postpartum with some other stuff. Can't hurt a thing.
Yeah.
But these specific things that we're not otherwise usually taking, but we think during a postpartum time, I should add these things.
Yeah.
That might be, maybe focus on, I'm not saying they can't be helpful, because I know women that they've helped.
Yeah.
I don't know if they're for every woman.
Yeah. I usually start with, let's start nutritionally. There's America, I have found, so again, I've traveled in so many different parts of the world, and that I love culture. I could read books on anthropology all day long. I loved studying different cultures, how they approach different things, how their religion affects them, all of that. And food, we're not real great in America on supporting our body through food. In fact, if you go to your doctor, they're going to say, depending on who your doctor, like Amy Lynn was saying, you might get one who's like, oh, food doesn't affect you. Well, I mean, a great example, I had a young girl, a mom was trying to regulate her period. And I said, just eat more sweet potatoes. Super cheap, inexpensive, eat more sweet potatoes. It helps with progesterone and estrogen regulation. She increased her sweet potato intake, and now she's regular. Simple, inexpensive. It didn't take you buying a pill. It didn't take you, hydrate, simple, hydrate, and if you're supporting your body with nutrition, chances are you're going to suppress your menstruation longer, because you're helping your body, you're supporting your body in that process.
Absolutely.
So I always start with nutrition. Before they're like, oh, what do you think about this supplement? What do you think about that supplement? So, well, let's start with, your just nutrition. Let's eat oatmeal with flaxseed and chia seeds and peanut butter in it and almond butter. Let's start there, and just these simple, basic meals. It doesn't have to be overcomplicated. We're already trying to figure out how to juggle, several things, a lot. So let's start with just simple, easy, nutritionally dense supplements, and support your body to get you through that.
Right.
And try not to be focused on the scale, right? Like that will just throw everything off. There's so much pressure, put on moms and women. And really, I think that that long-term amenorrhea, that's a huge component, like you can't be worried about that if you're wanting to, provide.
Yeah. Talking about a scale, another thing is, when was the clock invented? Okay, the clock wasn't invented till, modern society per se, right? 1700s, 1800s, was when it was invented, but it wasn't even implemented in all the communities, right? And how did women breastfeed then? They didn't just, oh, it's been 3 hours. Oh, it's been 2 hours. They got to know their baby. They got to know the strength of their baby. They got to know, they had grandmas there who were like, hey, your baby's hungry, like you should feed that child. Like they're acting like this, you should feed them. And I think that's why when we hear about back in, other societies, even still today, different tribal cultures, there's studies on how they've suppressed and how they do child spacing. And then, in past history, I think there was more of a intuition built into them that was encouraged in women to just follow their baby, to listen to their baby. And so the baby naturally, that dyad of the mother-baby relationship just symbiotically just worked. Whereas today we have a clock, we have a boss, we have, all these schedules, and we're like all about this productivity and this, all this, instead of slowing down in that beautiful moment and just enjoying and learning about your baby. people, babies are persons. Babies have personalities. I tell people, like, I look at my 12-year-old and I remember being pregnant with her and being like, that is the same child that was in my stomach 12 years ago. In their personality and getting to know the spirit and that person that they are. And I feel that with all of my kids, like, I'm like, that is the same kid. They're a little person. When they were 2 months old, that's who they were. Their soul and it's a beautiful process. And that's what I desire for all moms and dads, get involved. Like, my husband is so good on we've done natural family planning since we were married. It'll be 13 years in July. So that gives you and he will even he's based off of how I'm acting or just, when you're married, you see things and he'll be like, you're getting ready to ovulate. Like, you're getting ready to he'll tell me, cause I'll be like, I don't understand what's going on. He's like, well, I can tell you.
That's a good man. That's great.
But just that relationship and that connectiveness that it can bring to you, if we would just take out a lot of that extra noise, to help, and I think that helps with just natural family planning. You're connected with your husband, you're connected with your children. And anyway, it's a whole.
It all goes together.
Yes. Yeah. It all fits together. And I'm very passionate about helping couples and parents to. Parenthood will throw you into a whole other brain set, right? We have a whole other mindset when we're pregnant with our first kid. Oh, we're still going to do this. And we still have all these, and then we have the baby, and we're like, oh, there's a shift, which scientifically they do say parts of the mom's brain changes. So part of our brain will actually shut off. I say that loosely, but it shifts after you have a baby, and it goes back to the hypothalamus and the amygdala with the response to the hormonal shift of the prolactin and oxytocin and suppression of estrogen and progesterone. It all works together and it suppresses a part. So they say it's because the hunter-gatherer, we had to focus on our baby. So it's fascinating just how that shift happens.
That's amazing. That's amazing.
I want to take us to just one other little part here before we wrap up, because I want to be respectful of everyone's time. I know we got started a little bit later, but I wanted to look at that time frame I mentioned a little bit earlier of, just have a baby and say we're at a hospital setting and we're talking at that moment about, okay, what are we going to do for family planning? Mm-hmm. And how my understanding of protocol is that when nurses are going to discharge patients who are postpartum, they've got to make sure they have their family planning method to leave the hospital with. Again, I feel like I'm sure we all have different, passionate views on that time frame, but I know I feel like, again, that woman is just had a baby. There's a lot going on there. My biggest advice or suggestion to women is to have that conversation with your spouse before you get to that point, because that's not the point in time. I think that's where women are taken advantage of, is if they hadn't thought about it before, then they're in that time, they don't know how their body works. They don't know that they can't get pregnant right away, let alone they probably won't be having sex for a little while too.
Right.
So all of these things, this fear, this just the haziness of postpartum, to have that question asked to you, I think one is just kind of inappropriate at that time, but it is what it is and it's happening. So what would you say to a woman in that situation, Joy? I think, again, I've already said what I would say, which is don't make a decision at that point in time, because you will not be having sex for probably at least 2 weeks after you leave the hospital, if not more than that. So that gives you some time to think about it if you hadn't thought about it already. But if I'm counseling a woman who's still pregnant, I would say you guys need to, let's have a conversation. Let's inform you about what your body's going to be doing after you have this baby. And so we can make an informed decision with family planning.
Yeah, I would love to see that change in the hospital. Like you said, not take advantage of a mom who's right after that. So I would take the same approach as I did with you when you approached me with your questions back with your first son. And that is just, hey, here's some information. Why don't you do some research? You don't have to make a decision right now. Please don't feel like you have to make a decision right now. But there are options out there. There's a lot of, and if you plan on breastfeeding, birth control, being put on birth control right away after will also affect your milk supply. So there's some birth control that will, decrease it. Obviously, I can't say that to them. So I would love to see more information given to moms about their options and all of their options. I would
Right.
love to see all the options. Unfortunately, in a lot of your medical information that's given in the hospital, is NFP is not effective.
Right.
Where research does show that it's 98% effective if you meet all these criterias, right? And so it's really helping inform them, encouraging like podcasts like what you guys are doing, and just getting out there and talking to people and saying, hey, before you have your baby, like, think about these things, not to feel pressured, not to feel like you have to have whatever your idea is. I mean, everybody's quiver is a different size. So I'm not saying you have to have 20 kids or 2 kids or 1 kid. But that's something that you need to talk with your spouse about, and how are you going to do that. So I would just educate them as much as I could, given the restrictions as a nurse. We're not always allowed to freely tell our opinions, or so it's really just pointing people in the right direction is what I have found has been the most effective, is just, hey, why don't you read this article, or, read this book, or, what are your thoughts about this? And then kind of going with that, enrolling with it, and trying to advocate and educate, whoever you're teaching. Yeah, I hate it too, Amy Lynn, the fact that that's like the first thing you're asked. I mean, you just got a baby out. Like, nobody is about that.
Right. Well, and it's implying that you could get pregnant tomorrow.
Right.
I think that's one of my big things, is like just the lie that's there, that the untruth that's present
Mhm.
there, is that's not truthful. And, Emily and I have talked quite a bit on this podcast about sexual expectations within marriage, and how that's often not discussed even pre-marriage, when
Mhm.
dating. But I think that's also not talked about through the reproductive years and the years of having children, right? Of being pregnant. And then what does postpartum intercourse look like? And I say that for women, I would say mainly for men, because I think that because they're not women, right? They don't understand
Right.
how the body works. But I would say also for women who might not know, okay, what is this postpartum period going to look like,
Right.
and for them to be informed that, hormones are going to be changing, and that's going to impact her, her interest even in
Mhm.
sex. And how does nursing play into that? Like, when I have a baby that I'm nursing kind of all day, like, I don't know if I really want to be touched by anybody else at the end of the day, and I think, and so what does that dynamic look like? In what ways does she have to sacrifice a little bit of that, like, no one touch me anymore, recognizing her husband has needs and desires? And how does he have to self-deny because her body's in great demand by this baby, without getting resentful towards the baby about this?
Right.
Like, it's quite a dynamic, this postpartum time. But I think while all people go through it that experience having a child, not a lot of consideration is given to preparing for that. Even if the only preparation, I think, is just knowing that it's going to look that certain way. It's kind of like, we have a baby, and to your point earlier, Joy, like, this cultural idea of like, I had a baby, 6 weeks later, I am back to work. I'm back to this. And, like 100% again, it's like, how realistic is that? Like, is that necessary? Is that realistic? And I think setting expectations appropriately can just stay off so much resentment and discomfort, and marital strife. I think it can just be so helpful. So yeah, instead of asking what birth control do you want before you leave the hospital, maybe sitting and saying, so here's what this looks like. If you didn't know already, let's take an opportunity now to talk about it. Do you have any thoughts, Emily?
No, I just think it can take the pressure off of that time even more so if you are even somewhat prepared. Just like you said, even if you just know that things are going to be different, that can just, if everyone's on the same page, meaning you and your spouse, like, okay, we know that things are different. Maybe we don't even have the energy to talk about it right now, but like, we realize that's happening, or that's going to happen if we're still talking about, during the pregnancy. So no, I think that would be an amazing implementation for women after birth, to just be just exactly like you said it. If you didn't already know, here's what's going to happen.
Yeah. And they're told, like, abstain from, no vaginal penetrations or anything like that for 6 weeks, right? Well, some people think, oh, that means they don't want me to get pregnant. But it's actually just, hey, you might have had stitches. You just had a baby come through. Like, there's
you have a hole inside your body that's healing.
Right. It is not because that statement isn't because we're like trying to prevent pregnancy. Right. That statement is, hey, let your body heal. And like to your point, Emil, like helping the couple or the man, and helping them understand, like, there's the demand that was put on her body, but at the same time,
I had no idea that people could interpret that way. I've never thought about that.
Right.
Yeah.
And I think I feel such a passion for men, because I think in our sex saturated culture, the expectation is so low for them that, like, oh, men just want sex. Like,
right.
Well, sure. On average, and as a whole and on average, men have higher sex drives. But men, ultimately, their deepest desire from God is to love their woman. Their woman well. And so we can help them do that if we just give them information. Because I think sometimes what's done is men feel like they're not given, if you're not given the right information, well, then when they are still met with this strong desire postpartum, but their wife's going through all these things, well, then they almost feel guilty. Like, well, I have this desire. Like, what do I do? You're just kind of left here stranded. And one of the things I loved, Joy, about taking your class at the birth center was how you incorporated men into the nursing experience. And it was something I did with the twins that I didn't do with Max, which, sorry, I have Blaze here. Yes, you can do some work. Can you look? Oh yeah, he wants to look. Is the incorporation, say hi, is incorporating men into the nursing relationship of you nurse and then you let husband cuddle afterwards if you need a break. And I was like, it was so, I mean, obviously with the twins, I was outnumbered. So it was incredibly helpful and happy to do that. But I could see that with Max, I didn't do that. And I think I kind of hindered myself a little bit and kind of pushed to the point of like, I needed the touch break. But Max was so used to nursing with me and then cuddling with me. Like, it was always me. And I don't know. I go back to all the time. Like, man, I wish I had done what Joy had suggested. You didn't tell us to do anything, obviously, but it was like, here's a way that you can incorporate spouses into this relationship. So I think that maybe we can just end on that. Like, how we can, this is both people. This is the husband and the wife, and both have a unique role in family planning, in even the postpartum, the nursing years. Like, right, Joy? Like, spouses are not left off to the side. While they can't nurse, despite what our crazy culture had said in the past, men can't nurse. They can be part of that nursing experience in a different way. Can you speak to that a little bit, Joy?
Yeah. Absolutely. My success in breastfeeding my kids, I 100% will say, is because of the support I've received from my husband. I get teary-eyed, but I'm also postpartum. So, but he has been a huge support in everything I've done, but I could not have done what I've done on a career level or anything without his support. But especially when it comes to breastfeeding in that postpartum period, just talking to him, incorporating him, like he's holding our baby right now, back in the bedroom. Like, he knew I was waking up, and so he just takes her, and he's done that with all of our kids. And I can't emphasize enough the importance of incorporating your husband and your spouse in that process of everything, because we're actually making it harder on ourselves by not incorporating. I say he's a great dad. He's a horrible mom, but he's an amazing dad. Right. And you need that dad.
That, Joy. They're horrible mothers, but they're great fathers. Like, that's excellent.
Yeah. And I'm a horrible dad, and I'm okay saying that. Like, so I'm going to be a mom. I'm going to try to be the best mom I can, but I can't be the best mom I can be without his support, without him being the best dad that he is. And so, yeah, I absolutely take take advantage of that relationship. Going back to what I was saying earlier, just that dyad, it includes mom, dad, baby. If a mom comes to me and she says, she spills her heart out, and then I say, okay, who's your support system? Who's with you at night when you want to cry because you're up for the 15th time? Who's up helping you pick up the spit up or whatever it is, right? And if they say, oh, my husband, but he doesn't think I should breastfeed, he thinks I should just start supplementing, my battle has already lost. I know I've already lost. There is nothing that I can say or do if she does not have that spousal support.
Right. It's important.
So,
yeah.
It's very important.
Yeah. Yeah. And we see it with NFP too, right, Emily? Like,
yes. Yes. If the couple isn't on board, it's very hard.
And that's where we go back to like some of these things, they may be hard and they may be shining light. Like maybe the Lord is using this experience to shine light on a relationship issue that needs to be solved. It's not nursing. It's not your fertility that are the problems. It's some dynamic in the relationship that needs to be solved. And these are just, mechanisms by which this is coming up.
Right.
So we know you're in this postpartum time. Baby is a couple months old. Now, are you still working? Will you go back to quote unquote work? How can women or couples find you?
So currently, I knew that question was coming.
Because you're too good, Joy.
You are. You're way too good.
Yeah. So I've kind of hidden from this world for a while, except for I think the Lord keeps trying to draw me back out. And that's a story in of itself. And I thought I was supposed to just focus on just mother, wife, but it keeps incorporating in it. So as of 2020, I have just been doing word of mouth. So anyone locally, which Emily, we realized we're local together, they will send people my way. And that's just where most of my business comes from. Repeat clients, people sending people to me. I get text, called, emailed, probably more often than I need to advertise right now. So I'm fine with that. And so I've realized I probably need to step up my game and stop ignoring the call on my life in this department and get a little bit more professional per se. But I visit people at their homes. I've visited people at the hospital. I've done hospital visits. I have people come to my home. I just warned them I have 5 kids now. And I still give my classes that Amy Lynn was talking about. And that is also a as needed basis when a couple comes to me and say, hey, my friend took your class. Do you still offer it? I still openly offer everything. I just don't have set office hours. My husband is a captain at a fire department, so he works really crazy hours. So that's what we have found best to help our families just be flexible.
So if you're in Northwest Arkansas, you're in luck. And if you're not, then we have to have you back on the podcast, Joy, because we could just keep talking for a long time. And we need to wrap up the episode.
Yeah.
So we'll end with saying thank you for your time. Thank your husband for letting us use you for this time too. And I will I'll link in the show notes. Maybe Joy, you can send me like your top 2 or 3 favorite books for anything about breastfeeding, postpartum time, whatever. And if there's more than 2 or 3, you can list more and I will post all of those. So that way people can have that information. And I'm not joking. We would love to have you back on because I think there's just more that we could dive into. And since you're not, putting yourself out there in any way, we could be the podcast that does that for you, Joy.
I appreciate it.
We'd be honored
so much. Thank you.
Teaching and sharing because you're just such a wealth of information. So.
Thank you.
That's amazing. Yeah. Then you could reference people to just listen to the podcast and that take some pressure off of you.
Right.
Absolutely. Yeah. If there's topics you want to talk about, we'd be happy to host you for sure.
Thank
All right.
you.
I'm going to go get my kids. They're all ready for breakfast. So
yeah.
I'm going to get going.
God bless you. Congratulations.
Yeah. God bless, Joy. Thanks so much for your time.
Guys.
All right. Bye, you guys.
That wraps up another episode of the NFP Podcast. Thank you so much for joining us today. We hope you found our discussion enlightening and empowering. Don't forget to subscribe so you never miss an episode. We'd love to hear from you. Please connect with us by sending us an email with your questions and stories to thenfpshow@gmail.com. We'll be back next week with more insights, tips, and heartfelt conversations about natural family planning. Until then, love responsibly.